Hello everyone, this is Dr. Sahitya Bammidi, Consultant Obstetrician and Gynaecologist, KIMS Hospitals, Gachibowli. So today I am going to talk about the diagnosis of the Down syndrome. So how do you diagnose it and when you have to diagnose it is what I am going to discuss today. So if the whole 9 months is divided into 3 trimesters, the first 3 months is considered as the first trimester, the second 3 months is considered as the second trimester, and the last 3 months is considered as the final trimester or the third trimester. So as soon as your pregnancy test is positive, when you meet your gynecologist, she will advise you few blood investigations, and along with that we do a viability scan where we check where the location of the pregnancy and the age of the pregnancy, that is the gestational age of the pregnancy. So once we confirm with your first day of the last menstrual period, along with your, if you are having your regular menstrual cycle, and if it is corresponding with the scan expected date of delivery, we consider that as your expected date of delivery. So from then we calculate 11 to 13 weeks of 13 weeks plus 6 days, that is in the later end of the first trimester and the early second trimester, where we do this genetic testing. So this genetic testing includes an anti-scan and a double marker test. Together we call it as a combined test, and it is very important for every pregnant woman to have this test to check whether the baby is having any genetic syndrome. So this has to be exactly done during that period, that is around from 11 to 13 weeks 6 days, where your radiologist will do an anti-scan, that is the scan where they will check on your thickness of the nuchal fold, and if the thickness is fine or if it is abnormal, then you have to go ahead with a blood testing where we check on your beta HCG and PAPA levels, and together, like after combining these two tests together, we can assess the risk of your baby, whether it is in low risk or high risk. So if it is in low risk, we reassure you, and if it is in high risk, you need to do a confirmatory test where we have to take out the amniotic fluid or a small tissue from your placenta to exactly like to tell whether your baby is 100% having any syndrome or any problem. Thank you.